And I'm here with your disability rep, Roy Rickstrew. Roy, good to see you again.
Likewise.
Okay, Medicare plans. I mean, I know there are a bunch of different kinds, but can you straighten things out for me?
Well, it is open enrollment right now.
Yes, I know.
And so folks that have Medicare Advantage plans or have prescription drug plans, it's their opportunity this time of year to shop those, oftentimes with an agent, and try to decide if the plan that they're on is good for next year,
Right.
or if there's been enough changes that they need to revisit that. But there are several parts to Medicare, and most people are familiar with Part A and Part B. So
Yes.
A is our hospital coverage, it's free. Part B is our physician's coverage. It traditionally costs money. It's $185 this year for most people. It's going to go up to $205 or $206 next year for most people. And I say that because some higher earners end up paying more for Medicare than the rest of us do. So, you know, I say $185, maybe you're paying more than that because you had good years in the past.
Right.
And that's inflated a little bit because of your earnings record. And then, of course, there's the D plan. That was a big deal. Some of us are old enough to remember when they brought on the drug plan for the D program to help with prescriptions. And then, of course, there's Medigap or Medicare supplement plans.
Hear about those all the time.
And then there's Medicare Advantage plans, which if you turn on the TV this time of year, they are literally everywhere.
Yes, they are.
So there are a lot of different options to try to help round out your health care.
That doesn't seem like the easiest thing to navigate.
It's
not for me anyway.
No.
Or what do you need to think of with all of this stuff?
Yeah, so you know, most people this time of year are looking at either a prescription drug plan or a Medicare Advantage plan. And as the year rolls over, there's usually changes in the formularies, what medications get covered. And then, of course, there's also a change in the doctors that contract with the plan. So maybe you've been on a plan, it worked great for you last year, doesn't mean it will this year. Your doctor may have stepped away from that plan.
All right, let me ask, can you almost guarantee there will be changes?
Oh, there are definitely changes.
Okay, there it is.
Every
All
year.
right.
And what's really frustrating this time of year is that people will find themselves on medication that have been covered really well this year.
Yeah.
Small co-pays, and then that medication, for whatever reason, has fallen out of Medicare's favor, and it's not covered nearly as well, or it's not covered at all. It's not unusual to see people have significant increases in prescription drug prices because of the fact that these formularies have changed. Now, Medicare requires the provider to cover a drug in each classification for things. So there's whatever condition, there's a drug that Medicare will like to treat that condition.
Yeah.
It may just not be the one you're on.
So in order to have it covered, you may have to change what you're doing.
You may, or if you talk to an agent that can look these things up, can dig into it for you. Oftentimes they give people a hit list and say, look, these are medications that Medicare likes.
Yeah.
You need to talk to your doctor and see if any of these are suitable for you. So sometimes it's a change in prescriptions is the key to that equation.
Now what I get, I mean, I know there are places that you can go, you know, to look and find out all of this information, but that's a lot of stuff to go through.
Well, it is, and you know, you can go to Medicare.gov. I mean, that's the government's answer to try to shop these things. The problem is there's a lot of nuances that people don't understand from just looking at Medicare.gov. So maybe you're on an infusion, for example. Well, if your infusion is done in an infusion clinic, it may be covered under your Medicare Part B physician's coverage, as opposed to your drug plan. So there's no way you'd know that from looking at Medicare.gov, or it may be that Medicare likes the capsule, but it doesn't like the tablet for whatever medication you take.
Even though it may be the same thing.
Even though it may be the same thing, the price point may be considerably different, just simply because of the delivery method, where an agent will have a better chance of being able to say, hey, look, you know, here's what the system shows us, here's some things you may want to tweak, things you want to look at to try to make this work out better for you.
Yeah, and that sounds like it can be an easily, I don't know, easy mistake to make.
Oh, most definitely, yeah, it is. And anything that's government is complicated by its very nature, and this is no exception to that rule. So when people jump in there and they try to do things themselves, you know, they'll miss the nuances in the way medication gets covered. They may not be able to find their doctors in the network. Sometimes within a doctor itself, they'll be covered at one location but not at another. Perhaps the Springfield clinic is in network, but the Branson clinic is not. And there's just a lot of things that you can miss if you're not real familiar with these systems.
Knowing myself, someone who can be confused with put Part A in slot B, and that's all there is to it, and I can still miss it, it seems like a good idea to find someone who knows what's going on?
Well, and the frustrating thing here, you know, it's an older population when we're talking about Medicare. They didn't have computers in their classrooms when they grew up.
Yeah.
So they're not as computer or tech savvy as other folks are. And so you kind of pair that with a system that doesn't always perform the way we expect it would,
Right.
or is up and down as Medicare's website routinely is. It makes this a very arduous task for people. Somebody who understands it and does it pretty often has a much better, can give you much better feedback and get you better answers.
And you don't want to miss the sign-up window.
No, it goes through December 7th, Pearl Harbor Day, for whatever reason. Never understood why, but it's through December 7th. I do this work here in addition to other things at the Resource Center. I've been an agent for a number of years. Be happy to help. Just give us a ring here. The 882-1800 is the way to reach us for Medicare. Come see me. We'll hash it out.
Yeah, you answer your own phone too.
I do, yeah,
Absolutely.
as often as I can.
Roy, always good to see you.
Likewise, Tom.
So, you see the differences, you see the recommendations, give them a call here. Roy Rickster.